Most mornings begin the same way. A cup of coffee on the nightstand, a quick scroll through the news, maybe a glance in the mirror before starting the day. But let me ask you a question most women over 60 rarely hear. What if the one thing you don't do for your vaginal health each morning is quietly shaping your energy, your confidence, and even how comfortably you use the bathroom? I know it's not the kind of question people usually ask. But as a gynecologist with more than 30 years of experience caring for women, I can tell you your vaginal health is not separate from your overall health. It's one of your body's most powerful signals. It reflects your hormones, your circulation, your pelvic floor strength, and sometimes even gives you early warnings about conditions like osteoporosis or certain cancers. Ignoring it doesn't make it go away. Paying attention, however, can change everything. I'll never forget one of my patients, a 74-year-old woman who sat across from me and whispered, "I thought my body was just slowing down. I didn't realize something else might be happening." What she was feeling wasn't just old age. Her body had been sending her quiet clues for years, clues she hadn't been taught to recognize. Once she learned how to notice them, her comfort returned, her bladder control improved, and her confidence grew in ways she hadn't imagined possible. And she's not alone. I've cared for women in their 60s, 70s, even 80s, who believed that changes down there were simply part of getting older. But the truth is, many of those changes can be eased or even prevented with small, consistent habits. Habits you can start tomorrow morning, right after you wake up. That's why in today's video, I'm going to walk you through 7 simple, science-backed morning steps every woman over 60 can use to support her vaginal health and overall vitality. They're practical, quick, and deeply respectful of your body. And please stay with me all the way through tip number 6. It's the one almost every woman skips, yet it often reveals the earliest warning signs that something needs attention. But before we dive in, I'd like to pause for a moment. If you're new here, I want to welcome you. This channel is about giving women over 60 clear, compassionate, evidence-based guidance that most doctors rarely take the time to explain. If you find value in this kind of conversation, please take a second to like this video, subscribe, and tap the bell so you won't miss future tips. And if you have a friend or sister who might benefit, share it with her. You never know whose life you might quietly change. So let's get started. Imagine this. You wake up tomorrow morning before rushing to the bathroom before pouring your coffee. You take a moment to notice 2 simple things. First, you check your body with curiosity, not shame, looking for small changes that might be your body's early warning system. And second, you give your system the hydration it's been waiting for all night, setting the tone for the entire day. These are just the first of 7 habits that can help you feel more comfortable, more confident, and more in control. Because your health at this stage of life is not about perfection or chasing youth. It's about partnership, listening to your body's signals, and responding with care. And that starts in the very first moments of your morning. Now let's talk about the most common mistakes I see women over 60 make in the very first hours of their day. These habits might seem harmless, even automatic, but over time they can quietly undermine your vaginal health, your energy, and your confidence. The first mistake is rushing through the morning without paying attention to your body's signals. Most women have been taught to ignore or downplay what happens in the vaginal area. We grew up in a generation where these things weren't discussed openly. But here's the truth. The vulva and vagina often give you the earliest clues that something needs attention. Redness, a patch of skin that looks different, or even subtle swelling. These are your body's check engine lights. One of my patients, Barbara, age 67, noticed a small patch of pale skin that just wouldn't go away. At first she thought it was nothing. But because she mentioned it at her appointment, we caught a precancerous condition very early. It was treated quickly, and she returned to her life without complications. If she had waited for pain or bleeding, the outcome could have been very different. Think about it this way. You wouldn't drive your car for years without glancing at the dashboard. Your body deserves the same respect. Ignoring signals doesn't protect you. It only delays the chance to act while problems are still simple. The second mistake is going straight to the bathroom without hydrating first. I know how natural it feels. You wake up, your bladder is full, and you head straight to the toilet. But after 7 or 8 hours of sleep, your body is mildly dehydrated. Your blood is thicker, your circulation slower, and your kidneys are working harder than usual. If you relieve your bladder before hydrating, you're essentially asking your body to flush out waste without giving it the fluid it needs to do the job well. That puts stress on your kidneys and leaves your pelvic tissues just as dry as the rest of your body. One of my patients, Nancy, started a new habit. She kept a glass of room temperature water by her bed and sipped it before standing up. Within weeks, she told me she felt less urgency, fewer bladder twinges, and even noticed less dryness. Science backs her up. Hydration is one of the simplest ways to improve circulation to every tissue in your body, including the delicate tissues of your vagina. It's a small choice, but it pays off in comfort and resilience. The third mistake is forgetting to wake up your pelvic floor. Most women think of stretching as something for athletes, but the truth is, your pelvic floor muscles need just as much attention as your back or knees. When you've been lying still all night, blood flow to the lower body slows. If you start your day sitting at the table, scrolling on the phone, or staying still a little longer, your pelvic floor remains sluggish. A simple 60 seconds of movement, sitting tall on the bed, gently tilting your pelvis forward and back, then adding a few light squeezes of your pelvic muscles can make a world of difference. It's like reminding your body, wake up. We're going to need you today. I remember Elaine, a 69-year-old patient, who told me she was nervous to leave the house because of occasional leaking. After adding just 1 minute of pelvic movement to her mornings, she noticed fewer bathroom trips and felt more secure. She laughed and told me, "It's like my body finally remembered how to cooperate again." And here's a little cliffhanger. Many women think they're helping themselves in the shower each morning, but one of the most common cleanliness habits actually works against you. In fact, it can cause irritation, infections, and discomfort that last for months. We'll talk about that in just a moment, because it may be the one habit you don't even realize is quietly causing harm. So far, we've looked at 3 common mistakes: ignoring early signals, skipping hydration, and letting the pelvic floor stay sluggish. The good news is, each of these has a simple, science-backed solution. You can start tomorrow morning. Let's break them down into small steps you can build on over time. First, the short-term solutions. These are things you can begin right now without waiting for a doctor's appointment or special equipment. Start with observation. Tomorrow morning, before rushing through your routine, give yourself 30 seconds of gentle awareness. Look at your vulva, check for changes, and simply notice how you feel. Think of it like checking the weather before you leave the house. You don't need to overanalyze, but you do need to be aware, so you know whether to grab an umbrella. Pair this with hydration. Keep a glass of water by your bed and sip before you head to the bathroom. You're not only helping your kidneys flush toxins more effectively, but you're also sending fresh blood flow to your pelvic tissues. Within days, many women notice less urgency, less dryness, and more steadiness. Finally, add 60 seconds of pelvic activation. Gentle tilts of your pelvis while seated, followed by light squeezes of your pelvic muscles, are enough to wake up circulation and give you a head start against leaking or pressure. These are tiny habits, but they compound quickly when done daily. Now let's move to the medium-term solutions. These are habits you can strengthen over weeks to months that bring noticeable changes to your comfort and confidence. One of the biggest shifts comes from rethinking how you clean your body. Many women still believe that stronger soap or more scrubbing means better hygiene. But the vulva is delicate skin protected by natural oils and healthy bacteria. When we strip those away with hot water, harsh cleansers or douching irritation and infection become much more likely. Instead, think gentle. Use lukewarm water, and if needed a mild, unscented cleanser only on the outer skin. Avoid scented products, vigorous scrubbing, or internal washing. It may feel too simple, but countless patients of mine have relieved burning, itching, or dryness simply by changing how they cleaned. As I often tell them, your vagina is self-cleaning. Treat it with respect, not chemicals. Another medium-term shift involves rethinking breakfast. The first foods you eat each day shape your hormone balance, blood sugar, and tissue health. A sugary pastry or processed cereal may taste comforting, but it can disrupt your pH balance, increase the risk of yeast infections, and leave you sluggish. Instead, start with foods that support your body: plain yogurt with berries and flax seeds, whole grain toast with avocado, or a boiled egg with a handful of walnuts. These provide probiotics, healthy fats, and plant compounds that help tissues stay elastic and resilient. I think of Martha, a 68-year-old woman who swapped her morning muffin for yogurt with nuts and fruit. Within a month, she told me I didn't realize food could make such a difference down there. But it did, and it also improved her energy throughout the day. And finally, let's talk about the long-term solutions. These are habits that protect your pelvic health, not just today or tomorrow, but for years to come. The most powerful movement. Not exercise in the punishing sense, just the commitment to avoid long stretches of sitting still. When we sit too long, circulation to the pelvis slows, pelvic floor muscles weaken, and bladder control becomes more difficult. By standing up and walking for 5 to 10 minutes after breakfast, you reduce pelvic congestion and help your tissues stay healthier. One patient told me, "That little walk to the mailbox after breakfast made me feel like myself again." It wasn't a gym workout. It was simply honoring her body's need to move. Now I want to pause for a moment and ask something important. If these steps resonate with you so far, please take a second to like this video and subscribe. It lets me know these conversations are meaningful, and it helps more women just like you discover the care they deserve. And here's something to keep you curious. In just a moment, I'm going to share one overlooked drink that almost no one talks about yet. It makes a surprising difference for vaginal and urinary health. Stay with me, because this small change could add years of comfort and confidence to your life. At this point, you may be thinking, can something as small as a glass of water, a gentle stretch, or a mindful breakfast really make a difference after 60? And I understand that doubt. Many of my patients once felt the same way until they saw the transformation in their own lives. Let me tell you about Rose, a 72-year-old, who came to see me after years of discomfort. She had accepted dryness and irritation as her new normal, quietly enduring the frustration it caused in her daily life. She hesitated to travel, avoided social gatherings, and even pulled back from intimacy with her husband because she feared pain and embarrassment. When we sat down together, I asked her to start small, 30 seconds of observation in the morning, a glass of water before her bathroom trip, and a shift toward more nourishing breakfasts. Nothing extreme. Within weeks, she noticed changes: less irritation, fewer urgent bathroom trips, and even a return of natural comfort she thought was gone forever. She told me with tears in her eyes, "I feel like I've gotten a piece of my life back." Or consider Elaine, the 69-year-old I mentioned earlier, who struggled with occasional leaking. She felt anxious every time she left the house. After adding just 1 minute of pelvic activation to her mornings, her bladder steadied and her confidence soared. Elaine said, "I no longer plan my day around the nearest bathroom. I plan it around the things I want to do." These stories are not miracles. They're the natural result of listening to the body's signals and giving it what it needs consistently. Think of your body like a garden. If you neglect the soil, skip watering, or fail to notice weeds, the plants weaken over time. But when you check the soil each morning, give it the right hydration, and gently tend to it, the garden flourishes, sometimes even more beautifully than before. Your pelvic health works the same way. Small acts of daily care, hydration observation, gentle activation, thoughtful nourishment are the sunlight and water your tissues need. Ignore them, and decline can creep in quietly. Honor them, and you'll be amazed at how much strength and vitality you can regain. And here's the encouraging truth: it is never too late. I've seen women in their 80s adopt these habits and experience meaningful improvements. The body has an incredible ability to respond when given the right attention. So if you've ever thought, "I guess this is just part of aging," I want you to know you have more control than you realize. Your body is resilient. It's waiting for you to notice, to listen, and to care. And when you do, it rewards you with comfort, confidence, and dignity. In just a moment, I'll recap the key lessons we've covered today. But before we get there, I want to leave you with this thought: every small step you take is like planting a seed. The more consistently you nurture those seeds, the stronger your garden of health will grow. We've covered a lot together today, and I want to take a moment to bring it all back into focus. Because true change doesn't come from hearing information, once it comes from remembering and putting it into action. So let's recap. First, your body is constantly sending you signals. By taking a moment each morning to notice changes in your vulva without shame, with simple curiosity, you're giving yourself the gift of early detection and peace of mind. Second, hydration is more than quenching thirst. That first glass of water primes your circulation, supports your kidneys, and gently refreshes the tissues that keep you comfortable. Third, your pelvic floor is not a passive bystander. Just 60 seconds of light movement each morning wakes up. Those muscles improves bladder control and gives you a sense of strength that carries into your day. Fourth, respecting your body in the shower is as important as respecting it in the clinic. Harsh soaps, hot water, and dushing do not equal health. Gentle care, lukewarm water, mild, unscented cleanser. Nothing more is all your body truly needs. Fifth, what you put on your plate each morning is either supporting your balance or tipping it away. A breakfast rich in probiotics, healthy fats, and whole foods can improve your hormonal signals, tissue resilience, and energy. And finally, movement just a few minutes after breakfast prevents the slow, silent weakening that comes from too much sitting. Your body was designed to move, and every step you take honors that design. These habits may sound simple, almost too simple, but together they form a powerful message: I am paying attention, I am worth caring for, I am not giving up on my health. I've seen women in their 60s, 70s, even their 80s, transform their daily lives with these small steps. They rediscovered confidence, strength, and dignity, not through expensive treatments or miracle cures, but through consistent, loving attention to their bodies. And if they could, you can too. So here's my encouragement to you. Choose one of these habits to start tomorrow morning. Maybe it's that first glass of water. Maybe it's 1 minute of pelvic activation. Maybe it's replacing your breakfast pastry with yogurt and berries. Don't wait for the perfect moment. The act of beginning today, not someday, is what opens the door to lasting change. Before we close, I'd love to hear from you. Which of these steps feels most doable for you? Which one surprised you the most? Share your thoughts in the comments below. Your story may inspire another woman to take her first step. And if this message resonated with you, please don't forget to subscribe, tap the bell, and share this video with someone you care about. Each time you do, you're helping another woman discover that aging doesn't have to mean decline. It can mean empowerment if we choose to listen and respond. You are not alone on this journey. I'm Dr. Lisa Perriera, and it has been my privilege to guide you today. Remember, your health is not behind you. It is still in your hands, waiting for your care, your attention, and your love. Take that first step tomorrow morning. Your body will thank you. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.